2 billion. Pause on that number for a second. That is not the world population. That is how many people alive today are carrying tuberculosis silently inside their bodies. Right now, as you watch this, and 90% of them have no idea, no symptoms, no warning, no clue. That is what makes this disease one of the most dangerous in human history. Not because it kills fast, but because it waits. Before we go further, this video is for educational purposes only. It is not a substitute for medical advice. If anything you hear today sounds familiar, please talk to your doctor. So, what exactly is tuberculosis? You may know it by its shorter name, TB. In many parts of the world, it was called something even older, the consumption, because of how it slowly eats away at the body. TB is a bacterial infection caused by Mycobacterium tuberculosis, and it primarily attacks the lungs. It spreads through the air. Not through touch, not through sharing food, just air. When someone with active TB coughs, sneezes, or even speaks, they release microscopic droplets. You breathe them in. That is all it takes. But here's what separates TB from most infections you know. Once the bacteria enter your body, they do not always cause immediate chaos. Your immune system can trap them, lock them down, keep them dormant for years, sometimes decades. This is called latent TB. No symptoms, not contagious. But the bacteria are still there waiting. The moment your immune system weakens from aging, from stress, from illness, they wake up. And when they do, the damage can be severe. That is why understanding the warning signs is not optional. It is one of the most important things you can do for yourself and the people around you. Sign 1. A cough that has been going on for weeks. This is the most common sign of active TB and also the most dismissed. Most people chalk up a lingering cough to seasonal allergies, air pollution, or the tail end of a cold. They wait it out. They tell themselves it will pass. But a cough that has persisted for 3 weeks or more without improvement is not something to rationalize away. Here is what is actually happening. The TB bacteria settle into the lung tissue and begin causing damage and inflammation. Your body responds the only way it knows how, by trying to expel the threat through coughing. But because the bacteria have taken hold deep in the tissue, the cough does not stop. It becomes your body's long-running, unanswered alarm. 3 weeks is the clinical threshold doctors use as a red flag. If your cough has crossed that line and nothing else explains it, it deserves a proper look. Sign 2. Waking up soaked in sweat at night. You go to sleep feeling fine. Somewhere around 2 or 3 in the morning, you wake up and your clothes are damp. The room is not hot. You did not have a fever before bed. But somehow you are drenched. You change your shirt, go back to sleep, and the next night it happens again. This happens because active TB keeps your immune system in a constant state of battle, even while you sleep. The body produces heat as it fights the infection, and that heat needs to go somewhere. Night sweats are the result. They are often paired with low-grade fevers that spike in the late afternoon or evening, a pattern so consistent that doctors actually use it as a diagnostic clue. One night of sweating could be anything, but if it is happening week after week, your body is telling you it is working overtime on something it cannot handle alone. Sign 3. Losing weight without trying. The scale keeps dropping. Your clothes are fitting differently, but you have not changed what you eat or how much you move. For many people, this kind of unexplained weight loss feels like a strange kind of luck until they find out why it is happening. Active TB forces the immune system into a prolonged, energy-intensive fight. That fight burns through calories at an accelerated rate. At the same time, the infection suppresses appetite, so you naturally eat less. Fewer calories and more energy burned. When that gap becomes too wide, the body starts breaking down its own muscle tissue to keep functioning. What looks like weight loss from the outside is actually the body slowly losing structural material. This is not discipline. This is depletion. And it is a sign that something serious has been running in the background for a while. Sign 4. Coughing up blood. This one is impossible to ignore, and that is exactly the problem with relying on it as a warning sign. By the time blood appears in your cough, the TB bacteria have likely been damaging your lung tissue for months, sometimes longer. Here is the progression. As the infection develops, it creates small areas of damaged tissue inside the lungs. These damaged areas expand over time. Eventually, they reach the walls of tiny blood vessels running through the lung. When those vessel walls weaken and break, blood leaks into the airway, mixes with mucus, and comes up when you cough. It might be a faint pink tinge. It might be a visible streak of red. Either way, this is not a symptom to observe and wait on. Get to a doctor the same day this happens. Sign 5. Pain in the chest when you breathe or cough. A dull ache. A sharp stab when you take a deep breath. Pain that seems to worsen every time you cough. Many people write this off as a pulled muscle or sleeping in an awkward position. Occasionally, that is the right explanation. But when chest pain appears alongside any other sign on this list, it takes on a different meaning. TB can spread beyond the lung tissue and reach the pleura, the thin two-layered membrane that surrounds each lung. When that membrane becomes inflamed, a normally smooth surface turns rough. Every breath causes those two layers to scrape against each other. The pain tends to be sharp on inhalation and worse when coughing. Your lungs are not supposed to hurt when you breathe. When they do consistently, your body is flagging something real. Sign 6. Feeling exhausted no matter how much you sleep. You wake up tired. You move through the day feeling like you are carrying something heavy. You sit down in the evening and feel like you have already run a full marathon even though you barely left your desk. This kind of fatigue is fundamentally different from the tiredness that comes from a demanding week. It does not respond to rest. It does not lift after a good night's sleep. It does not improve on weekends. It just sits on top of you like a weight that will not move. When TB is active, the immune system is running at full capacity around the clock every single day. That kind of sustained internal effort demands enormous energy. The body quietly redirects resources away from everything non-essential and channels them into the fight. Daily tasks start to feel heavier. Focus becomes harder to hold. Small things feel disproportionately draining. This is not burnout from work. This is what it feels like when your biology has been quietly at war for too long. Sign 7. Symptoms that have nothing to do with your lungs. This is where most people's mental picture of TB stops. That is also where the real danger begins. TB is primarily a lung disease, but it is not only a lung disease. When it goes untreated and the bacteria find their way into the bloodstream, they can travel to virtually any organ in the body. And wherever they land, they cause damage that looks nothing like a respiratory illness. TB in the brain triggers bacterial meningitis, severe headaches, confusion, sensitivity to light, and stiffness in the neck. TB in the spine causes deep, persistent back pain and in advanced cases can compress the spinal cord and lead to paralysis. TB in the kidneys silently disrupts their filtering function, producing abnormal urine results that often confuse doctors who are not thinking about TB. TB in the lymph nodes causes firm, swollen glands in the neck that grow slowly over weeks. Each of these looks like a completely separate condition, but the same bacteria are behind all of them. Once TB spreads through the bloodstream, the damage accumulates across multiple systems, and some of it cannot be reversed. Sign 8. Carrying TB without knowing it. This last sign is not something you feel. It is something you may already be living with completely unaware. Latent TB has no symptoms whatsoever. The bacteria are dormant, held in place by a healthy immune system doing its job. You feel perfectly fine. You are not contagious. You can go years, even decades, with no indication that anything is wrong. But the bacteria are not gone. They are contained. And research confirms they can remain in that dormant state for 20, 30, even 40 years before the right conditions trigger them to reactivate. What creates those conditions? anything that weakens the immune system. Aging naturally reduces immune function over time. Diabetes impairs the body's response to infection. Long-term use of corticosteroids suppresses immune activity. Malnutrition depletes the resources the immune system needs. HIV directly attacks the immune cells responsible for keeping TB dormant. When any of these factors take hold, the bacteria sense the shift. They begin to multiply, and by the time symptoms appear, the infection is already active. A simple skin test or a blood test called an IgRA can tell you whether you have ever been exposed to TB. If you have spent significant time in a region where TB is common, if you work in healthcare, or if you have any ongoing condition that affects your immune system, this test is not optional. It is the only way to know. Here's the part worth holding on to. TB is one of the most treatable bacterial infections in medicine as long as it is found in time. A combination of antibiotics taken consistently over several months can eliminate it completely. The earlier it is caught, the shorter the treatment. The later it is found, the more damage has already been done, and some of that damage stays. The reason most people reach the later stages is simple. They did not know what the early signs looked like. Now you do. Share this with someone who needs to hear it, a parent, a friend, anyone who has been brushing off a cough for too long. It could be the nudge that changes everything for them. Hit the like button if this opened your eyes to something you did not expect. And subscribe, because the most important health information is almost always the kind nobody thinks to look for until something goes wrong. Your body does not exaggerate. When it sends a signal, it means it. The only question is whether you are paying attention. This video is for educational purposes only. Always consult a qualified healthcare professional for proper diagnosis and treatment.